We've got a very special guest joining us now, Luigi D'Aquino, the Chief of Health of UNICEF India. So there have been disruptions in the delivery of immunization services which have been caused by the pandemic. So everything that organizations such as UNICEF have worked towards in the area of child immunization could actually be sliding backwards, and that's a real worry. How would you tackle that?
I think countries around the world have learned and experienced different degrees at different times of disruption of services, health services in particular for women and children, of course including immunization. Now the good news in a way is that as we continue, I think we are now in 1 year journey through this pandemic, as we continue living with this pandemic, we also improve day by day in living with it and adjust our lives to it. So the level of disruptions that has occurred in many services in a way has been very strong in the beginning during the lockdowns and when everyone was caught off surprise and all the systems, social, economic systems were disrupted in many countries. As this moves, we see more and more that, again, we are adjusting and making better progress in resuming services. In this regard, immunization is a great example compared to other services for what we know, in that it has been, in a way, faster and very effective in restarting the services after the lockdowns or even during.
Yeah. Very interesting, Luigi. Thank you so much for being with us. I wanted to ask you a question, but before that, you'd be glad to hear, since we're talking about immunization, Adar Poonawalla, whose Serum Institute of India is the world's largest manufacturer of vaccines by number of doses produced, has also sent NDTV a message in support of this campaign this evening, Reimagining Our Children's Future. It's great to hear that. It just goes to show how really vital this campaign. Now the question is, how do we ensure that COVID immunization program, which is like of highest priority, and in India it'll be in fact the world's largest ever immunization program, how do we make sure that this COVID immunization doesn't undermine all the other immunization campaigns that UNICEF and the government are doing for our children?
I think we first have to think that we're dealing with something unique and that immunizing children is not the same business about providing a new vaccine to a completely different group of people, which is largely going to be adults. So to some extent, the delivery machine, or when and how and where the COVID vaccine will be offered and administered will not necessarily crash and overlap with what is the immunization schedule for children. Second, of course, you need to make sure you have enough inputs, the resources. One of the critical resources is the vaccinators. So the people who need to deliver the immunization for COVID-19 and for routine immunization. And in that regard, plans are already in place from the Ministry of Health to make sure and be sure that there are enough vaccinators across the board to provide the vaccine for COVID-19 without disrupting the routine immunization services. The other critical input you need is to preserve your cold chain system. So as I said earlier, vaccines do travel and need to be traveling across the country at a certain minimum temperature. Now, when you introduce a million of doses of a new vaccine in addition to what you already have for women and children, you need to expand your cold chain. And this is already being done. So as we prepare and very much to welcome this new vaccine, we are putting all the checks and balances in place to make sure that there is enough cold chain and cold storage capacity to accommodate both the vaccines that are the traditional ones for women and children and the new ones that will come for COVID-19.
Luigi, what difference will the funds raised in this show make to your work at UNICEF?
We at UNICEF have a dream, an aspiration and a vision. We will work and work to make sure that communities and families everywhere are aware of what are the key behaviors, what are the key practices they need to take to ensure healthy pregnancies, healthy delivery, and a good follow-up of the babies as they grow through their life. We work to have healthcare workers, nurses, doctors, and also the community healthcare workers well-trained, motivated, safe and protected during COVID-19 and ready to take action to support pregnant women, babies and children as throughout the stage of pregnancy, delivery, and then growth of these children. We work to make sure that equipment and supplies are in place, be it in a delivery room, be it in an immunization session, be it in a COVID facility. We work to support that agenda as well. And we work to ensure that technology is used at its best to track patients, to consult patients, and to use the data to better tailor healthcare to the needs of people. Of course, we don't do this alone. We are a small actor amongst many, but our small contribution will hopefully serve a much bigger cause.
Luigi, thank you so much for joining, Chief of Health, UNICEF India. And it was nice to know, as he explained, because we all are waiting for the vaccine, that how the cold chain systems will be maintained and they are being expanded.